Good morning. Is your name Debra, Dr. Debra Mlongo Barasa?
Yes, Honorable Chair.
I'm not a chair, I'm speaker or chairman.
Okay.
Yes. You will take an oath before you get engagement with us. You have a choice between the Bible, the Quran, or affirmation, depending on your faith. Which one do you opt for?
The Bible.
Go ahead. Be upstanding.
I.
Your right hand. And then speak to the mic.
I, Dr. Debra Mlongo Barasa.
Is the mic on? Sergeant?
I, Dr. Debra Mlongo Barasa, do swear that the evidence I shall give before the committee on the matter under its consideration shall be the truth, the whole truth, and nothing but the truth. So help me God.
Very good. You may take your seat. Dr. Barasa, welcome to this session of vetting your suitability to hold office to which the President has nominated you. This is a committee of Parliament discharging its responsibility under the Constitution and the law. Yours truly here is the Speaker of the National Assembly and the Chairman of this committee. With me on my right is the distinguished Deputy Speaker of the National Assembly, Honorable Gladys Boss. On my left is the Clerk to the National Assembly, and I'll invite all members to introduce themselves.
Chamani Shongo. Junet Mohammed.
Nelson Koech.
I'm David Kosing, MP, Poko South.
Vicaria David.
Mary.
Mary Emase.
Abdul Rahim Dawood.
I'm Ferdinand Kevin Wanyonyi.
Owen Bayer.
Robert Mbui.
Stephen Mule.
Didoraso.
Abdi Shurie.
Mishimboko.
Caleb Amisi.
Excellent. Dr. Barasa, we'll start by inviting you to make a brief introduction of yourself in not more than 5 minutes, telling us your name, your educational background, your work experience, and any key competencies that you have that you think is suitable for your appointment as a cabinet secretary. Go ahead.
Honorable Chair, honorable members, I'd like to take this opportunity to appreciate His Excellency the President, as well as the nominated committee, to give me this opportunity to present myself as the nominated Cabinet Secretary for the Ministry of Health. Thank you so much for your invitation and consideration.
That is your name, your education background, work experience.
I am Dr. Debra Mlongo Barasa. I am a qualified medical doctor. I have more than 18 years medical expertise and public health professional background. I'd like also to say that I am a wife, a mother, and has 4 lovely children. I'm also a twin. So I have a vast experience in terms of policy advice, strategic direction, technical advice, and clinical practice. I have worked in the public sector as well as the private sector. I have worked from the primary care level, the community health programs, up to national level at the Kenyatta national level. I have also worked with the national technical working groups within the ministry. Equally, I have served with multiple Ministry of Health focal points within the Eastern Southern Africa region. They are 22 countries in number, as well as the 47 WHO Afro member states, supporting them in strengthening their IPC or infection prevention and control programs. I have also been a participant in global strategies, global action plans, and also in the development of guidelines at a global level. In WHO, I worked for more than 4 years supporting various member states in strengthening their infection prevention and control programs. I supported them in matters policy advising, in strategic direction, and in technical advice. Implementing activities including development of guidelines, facility assessment, among others. My key achievements in the span of my medical practice include the strengthening of programs. At the beginning of COVID-19, we had only 4 programs within our ISA, 4 countries with infection prevention and control programs within the Eastern Southern Africa region. And at this time, I'm proud to say that we have 22 countries within the Afro region which have strengthened their infection prevention and control programs. So I supported in matters of development of their strategic, their national action plans, and also in developing guidelines, facility assessment, monitoring and evaluation framework, among others. Equally, I supported in emergency response, in emergency preparedness, readiness, and response pillar.
That will do. I will now invite the Deputy Speaker to be the first to ask you a question. When questions are asked, to expect precise and concise answers.